Our project is called Mindanao Motherhood, Family Planning and Empowerment of Women. Our class's grand challenge is 11 billion people. How long can the planet sustain humanity? So our small-scale solution to that problem is to address family planning, reduced inequalities, and gender equality through our project. What we'll be doing specifically, or the analytical components of this project, include that we will have 2 teams. We will have a Mindanao headquarters team and a Caraga outreach team. The Mindanao headquarters team will focus on community partnerships, resource acquisition, and technological outreach. And the Caraga outreach team will focus on educational seminars and very limited free birth control. Our project will be volunteer run, with the headquarters team and the outreach team having volunteers from the local community, but we will also have a small core team of paid employees, including 2 local social workers, 1 for each team, to help run the project. Transportation will consist of 5 traveling buses or RVs, which will be fundraised or funded through grants from the Planned Parenthood Global and United Nations Population Funds. Our project is free and accessible because there is no charge for seminars or resource connection for the communities we're serving, and the resources we're referring people to will be free or low-cost places. Finally, we'll be taking into account the local culture and the incentive to participate. So 71% of the population in Caraga identifies as Roman Catholic, so we'll be providing church-sanctioned resources as one of the options that we have. We'll also be employing 2 social workers, 1 for each team, like I mentioned, which will help communicate with the women we're serving in a culturally appropriate and relevant way.
Why our project? Family planning is the way that individuals, couples, and families take steps to prevent unintended pregnancies by deciding the number, timing, and spacing of children they will or will not have. Contraceptives are an important part of family planning, and they come in many different methods. Family planning reduces the likelihood of maternal and newborn deaths, increases overall health and life expectancy, and allows young girls to remain in school and receive a full education. Family planning in the Philippines has been a critical subject for years. Rates of modern contraceptive usage are far off par for the country's needs, as are adolescent birth rates and birth rates for poor and rural areas. The 2 SDGs addressed are Sustainable Development Goal 5, achieve gender equality and empower all women and girls, and SDG 10, reduce inequalities. In the Philippines, major challenges remain for achieving both of these goals.
Sustainability, an integrated approach. With our project, the SDGs that we focused on were family planning, gender equality, and reduced inequalities. The family planning goals we wanted to accomplish with our project are empowering women to decide whether and when they wish to become pregnant, as well as how many children they wish to have, and developing strong partnerships among and between a broad base of stakeholders, community, governments, political leaders, civil society organizations, including faith-based organizations, the private sector, donors, and multilaterals, to help ensure high-quality service delivery, outreach to more disadvantaged groups, building community support and program accountability to the people served. The gender equality goals we want to accomplish are ensuring universal access to sexual and reproductive health and reproductive rights as agreed in accordance with the Program of Action of the Internal Conference of Population and Development and the Beijing Platform for Action and the outcome documents of their reference conferences, and enhance the use of enabling technology, in particular information and communications technology, to promote the empowerment of women. The reduced inequality goal we want to accomplish is by 2030 empower and promote the social, economic, and political inclusion of all, irrespective of age, sex, disability, race, ethnicity, origin, religion, or economic or other status. Who will it help? The impact. In the case of our project, we would like to bring maternal and feminine health and family planning resources and education to remote areas of the island of Mindanao, specifically the remote area of Caraga in the Philippines. A 2020 study shows the differences in women with prenatal care and their children compared to those without prenatal care in the Philippines. This study determined the impact of access to maternal and child health affects the health of the child growing up. It also determined that access to maternal and child health increases the child's likelihood of survival, and they have better health throughout their life. In 2008, a group of nonprofit organizations delivered maternal health care resources in the Philippines during an internal conflict in the area they were serving, Mindanao, Philippines. These organizations collaborated with the Filipino government and the Department of Public Health to get maternal health care and family planning resources to women in need in Mindanao area during a time of unrest and internal conflict. The Filipino government allowed these two organizations to take up residence in some of the government-owned spaces in the area, and they use these spaces for their maternal health and family planning services. Our project is very similar to the one that was just described, which means we are able to have an impact in the area.
Financial viability of this project is that the free services will be presented to all the people who are willing to work with us. This will be sponsored by Philly Health, which is the local health insurance through the government. The Planned Parenthood Global sponsors lots of programs throughout the country and throughout the world that will encourage women's health, along with the United Nations Population Fund, which will also distribute funds. These collective choice arrangements, which will empower and employ local women, increase this positive feedback loop that will feed into the program. Volunteers will come from the University of Mindanao and will typically be long-term residents. The employees will be only the Mindanao Motherhood organization and core staff to decrease costs. The innovation of the solution is that it brings together resources into rural areas, which has not before been done in especially the Mindanao area. In 2012, the Responsible Parenthood and Reproductive Health Act was passed, embracing women's health in the country, and the current sitting president also encourages women's health, yet there is still a 33.9% unmet need, indicating that services are still needed, especially in those rural areas. Focus on congruence with the local condition. Employ and recruit locals for the program, and that will encourage women who are locals to trust and encourage other women to enroll in the program.
Looking forward, scalability. Potential for expansion in Mindanao. There are many other resources, mostly educational focused, that would be a good opportunity to bring to our project specifically located in Mindanao. Potential for expansion in the Philippines. This resource connection organization can be expanded to other locations in the Philippines with high birth rates and unwanted pregnancies. This project could also bring upon great benefits in other countries of Southeast Asia or Oceania. Some of these countries include Cambodia, Papua New Guinea, Indonesia, and Vietnam, all of which face significant challenges in family planning. Successes and challenges encountered will be either applied or revised for further implementation of the program.
Our hopes. One of our aims is seeing the Philippines become on par with family planning needs, including birth rates and contraceptive prevalence. Additionally, it would be incredible to see all women of the Philippines have a sense of confidence, independence, and empowerment.